to the partnership meeting. We are a couple minutes after 9. We've got uh, we've got a quick bit of partnership business to work through, and then we're going to get to the Rural Mental Health Symposium. I appreciate everybody joining. For those that don't know, the Wayne County Partnership is a group of. Good morning, Sherry. uh, the Wayne County Partnership is a group of 45 plus organizations and schools and agencies that meet 5 times a year in large group. We meet in 3 work groups, including the education work group, the family resource work group, and really driving the ship today is our Wayne Wellness Work Group, focused on overall wellness. And I really want to give a shout out to Margie Tabor, that's been shifting our focus to a broader view of wellness and really encouraging us to think more universally about what wellness means. So with that said, David, I just want to ask you if you've got any updates, and I can stop sharing if you need to go. Do you need to go to the website for those, or
I could.
or do you just want to tell people to go to the website?
Let me pull it up, just in case there's a person or two in the audience that hasn't seen it.
So I'll stop sharing so David can share, and we'll also get a look at some faces here for a second. And I do want to tell you that the partnership website is pretty easy. I'll drop that into chat. It is just waynepartnership.org. And while I drop that into chat, if you would also just sign in yourselves into chat, that would be great. We'd really just like to have everybody go ahead and type in your name and your agency. Would really appreciate that. And David, take it away.
All right, thanks, Jay. Like Jay said, the website is waynepartnership.org, and we have all kinds of resources here for you to use. I want to sound like a broken record and talk about, first of all, the newsletter. So if you go to About Newsletter, you can subscribe to our newsletter. It comes out every other Thursday. This is your opportunity to share what's going on with your agency, upcoming events, and anything else that you want the partnership and the rest of the world in general to know. And also there's a link to submit a letter or an article for the newsletter. This is the best way to do it. You can email me, but every so often something gets lost in my email. So if you want it in the newsletter, this is your best way to do it. Again, that's About Newsletter. And here you can subscribe. Anybody can subscribe. So please feel free to share this far and wide. I'd like to get up to 1,000 subscribers this year. And we are currently at about 400. So feel free to share the newsletter with your friends, colleagues, family members, neighbors, everybody. Don't have to be in Wayne County, but it helps. Also, we have recently taken over the management of the Wayne County food distributions. And if you go to resources, food distribution, you'll find a page there. I'm sorry, this is out of date as of yesterday, but it'll tell you where the next distribution will be. It'll give you the locations for the remainder, because as of the end of June, we will be done. FoodLink is providing us with the food every Tuesday through June 29th. And after that, we are going back to the food pantry model. And the partnership is going to work with FoodLink and the food pantries to figure out what is needed, what kind of resources we need to get the most food into the most people's hands. So look for that. That's coming up soon. We'll have a plan. We've also got back on Monday distributions. They started this week. We had 300 boxes, which we delivered out thanks to the help of all of our partners. On the 24th, we are going to be receiving 12 pallets or 720 boxes, and we will do that twice in June also. So again, I'm going to update this website later today, and you can, if you are interested in getting some boxes to deliver to people that you serve, or people that you know of that are in need. The Monday distributions are for you. They're for agencies and organizations who serve people, who know people that are in need. So we can call them a bulk delivery. These are not open to the public to drive through like the Tuesday distributions. So just get a hold of me and I'll put you on the list and we'll figure out what it's going to look like in the next couple days. We're hoping to have multiple drops around the county to limit travel. So that's where we stand on that. If you would like to volunteer for a Tuesday distribution, there is a sign-up sheet here. If you're interested in receiving a Monday shipment, contact me here. And so that's basically everything you need. There's the posters will be here, and we appreciate any advertisement of the Tuesday distributions that you can do. And I think that's about it.
You want to do a volunteer recruitment?
Yeah, we do need volunteers. So if you go to the again resources food distribution page and scroll down to volunteer opportunities, here is the form. It will ask you which dates you're interested in volunteering for, and we are getting a little light on volunteers. So we've opened this to the community, but they're getting a little tired and distribution weary apparently. So if you know of anybody that would be willing to help on a Tuesday, please send them to this page. Right now, this is for May. This form is for May. The June form will be going up in a day or two once we've firmed up all of the locations. But please, please, please consider volunteering or pass the information along to someone who might be interested in volunteering. We need all kinds of people. I don't care if you can lift 100 pounds or 1 pound, or if you can put apples into plastic bags, we need your help.
All right. Thank you, David.
You're welcome.
The partnership website remains really just for us a critical communication tool, and we hope you'll continue to use that. And for everything from food distributions to a way to sign up for classes, it's all there. Just wanted to remind you that we're always focusing our work on the collaboration arch. We want to build attachment. So how to trust, how to cope, how to learn, how to be healthy. And we want to work together to do that. We want to help families, young people. Never a bad idea for you to take care of yourself in this way too. If you're looking for a self-care plan, I'll take no comments from the peanut gallery on that. You can always ask yourself, how am I doing with attachment? What am I doing for my own health? Things of that nature. So this is the arch works because it's real. It's a national model. Right. So National Child Traumatic Stress Network and other folks use that. We added in health that came out of some Leslie and Trauma Learning Policy Institute stuff. And we added the collaboration because we realized we need to all pull together on that. And there's some good research that supports what our value metrics use survey, sneak peek at the 2021 results, which we'll go over in full August 5th at our August 5th meeting, which we hope to be in person. So we don't have, not really breaking down a lot of the details for folks yet, because we just want to push on the accuracy. But a key thing that we found, this is February 21, so this is a couple months ago data. Proportion of 12th grade students at greatest risk, 5 or more risk factors, still is lower than it was in 2013. In another comparable rural county, it was only a 4% decrease over that time. And in 10th grade students, we actually saw a 26% decrease in risk factors, where a comparable county that actually increased 10th grade by 20%. So working together matters. Working together makes a difference. And know that we all have our own programs and we're all very proud of what we do. But our focus, when we can remain focused on young people and we can avoid silos and we can avoid building walls, then we can come together and meet the needs of young people. And overall, we really are doing that. So keep being collaborative, keep putting the person first in whatever place you're serving. I want to highlight Jill Harper. Jill, can you wave? I'm going to see if I can do something like, I'm going to spotlight Jill for everybody for a second. Hi, Jill. Jill is our school health integration specialist. She's going to be based at Soda Central School District with a 4-year project, the Greater Rochester Health Foundation, focused on SOTUS, Clyde Savannah, Lines, and NRW, but can help anybody. We're looking at putting that collaboration arch together using health. So here's some of the cool stuff she could do. We've been talking about everything from toothbrushes to health insurance access to telehealth. Jill's had a busy first week. She has made it to every district that's in a folk. I'm not sure. I think you're in 2 or 3 districts today, Jill. So I appreciate you doing that. And we'll get back to you for a further update. Jill will be joining the Wayne Health Improvement Partnership. Want to remind you that for us, for the partnership, when we're looking at health outcomes, we tie together with public health. They run a partnership, so we don't duplicate that by running our own. All right. When we're talking about physical health and wellness, we connect to public health, and that is going to be running on Fridays. So you can email Diane Devlin, the director of public health. You can reach out to Jill. You can reach out to David or me if you're interested in helping out with basic wellness. Please go right there. Why basic wellness? Let's take a look at some quick numbers. This is Wayne County, the red dots. This is New York. All right, so if you look at around 2011, you'll see, right, the Great Recession right around then, and other people started to recover and we didn't. So that right there is premature death, right? That is adult obesity. This is Robert Woods Johnson data, by the way. This is clinical care. This is how to find a doctor. All right, how to find a dentist. Mental health providers is a little better. It's 1,360 to 1 back in 2015. A little better, 950 to 1 compared to 330 to 1. New York State. Okay, so still not doing so well. But if you look at doctors got worse. 3,000 to 1 was pretty bad. Now New York State got a little better, and we got way worse. Now it's 3,920 to 1. So we're really trying to push on that. As it turns out that, physical health, overall wellness, all that, and again, a shout out to Margie for helping us look at wellness in a broader lens, but really some pressing need here. And for schools, I have to tell you, one young person had amazing improvement in their grades when we got him some glasses earlier this year. And the number of young people that are missing school for toothaches and for, absolute agony. I mean, I don't know if anyone's ever had a bad toothache, but the real kicker though is beyond toothaches, in one side of the county to the other, you can expect to live 10 years longer, right? 10 years longer, same county. And this is from Common Ground Health's Wayne County Health Profile. And I want to thank Common Ground Health for their work in this data poll and all of this, this effort to highlight need. But in one county, if you're born literally, right, 15, 17 miles apart from each other, you could expect to live 10 years longer or 10 years less. And if we're okay with that, we probably ought to do some soul searching. So we have some work to do, and we have every reason to collaborate and every reason to work together so that those, everybody's got a full life and a long life. To that end, one thing I do want to highlight quick is we're going to continue to push on mental health first aid. Margie, get ready to smile because I'm going to try and spotlight you for everybody now. All right, there you go. Wave, Margie. If you got questions on mental health first aid, there's Margie and there's Mel. Team Mental Health First Aid, we're really starting to push out. You can reach out to BOCES, Peter Dole, you can reach out to Hennessy, you can reach out to me. Trying to get classes for young people to help other young people. 70% of the time they're going there. Youth Mental Health First Aid is to help adults do a better job helping kids. And Mental Health First Aid, boy, there's an entire bouquet of that. Great options there. And Hannah, are you on the call?
Yes, I'm here, Jay.
All right, I am going to make sure that I've got screen sharing on, and I'm going to ask you to take it over for a second if you can.
Yes, will do. Let me pull up my slides here. Okay. Can everyone see that okay? I'm going to take that as yes. All right. So I'm adapting these slides from an earlier presentation. So I'm going to try and fly through this in just a couple of minutes, and I might skip over some stuff. But wanted to thank you, Jay, for we planned this late last night for me to jump in and share about this awesome project that we are just wrapping up.
You didn't have to tell that part, Hannah. Nobody would have known. No, seriously, thank you. And you've got 10 minutes if you need it.
Okay, sounds good. And I'm from Common Ground Health, if that wasn't already mentioned. I'm the program coordinator for the community health and engagement team there. So work on the Healthy Kids Initiative, as well as our community health and well-being work. So the FLX Teens Are All Right project, this was a youth mental health and well-being and health literacy project that we have been working with teens on over the last couple of months. This was our project team. I'm going to skip over that for now. We also had our youth team. So we had 15 youth representing over 10 different school districts from 5 counties in the Finger Lakes: Livingston, Monroe, Ontario, Wayne, and Wyoming. It was a diverse group with representation across different ages, races, ethnicities, gender orientation. Really, really awesome group. When we put out the applications for this project, we thought we would struggle to find the 10 to 15 we were looking for. And in a matter of a week or so, we had over 300 responses from teens across the region wanting to participate in this opportunity to learn more about mental health. And on our application, we asked why they were interested in participating, and to read the responses it was incredibly moving. So many teens not only experiencing mental health challenges and wanting to learn more for themselves, but also wanting to learn more so that they can support their peers and family members who are struggling. So we went through and we tried to identify those that really had some compelling reasons for wanting to participate. We also took a look at some of our socioeconomic status data, similar to the map that Jay just had up, and tried to really hone in on the school districts in those 5 counties where the highest low socioeconomic status rates are. So that was how we identified our team. Little background on the project. This project was funded by the network of the National Library of Medicine. Their mission includes improving public health by improving the public's access to information that'll allow them to make informed decisions about their health. So that's exactly what we were trying to do here. Improve mental health literacy in teens so that they're activated to make informed decisions about caring for their mental health. And our goal for this project, and to start, it was called FLX Kids Are All Right, but we did change it to teens to be more reflective of the audience we were really targeting. So the goal was to improve mental health literacy for middle and high school aged youth in those 5 counties. And we aim to do this by creating new mental health and well-being literacy resources to specifically improve library collections and programming. So since this was funded by the National Network Library of Medicine, this was meant to really be an intervention in the public libraries across the counties and improve the resources they have, so library staff are able to better support teens when they're coming to find more information on mental health. I don't need to cover this slide. A lot of this data we pulled from some of your youth surveys in Wayne County, but I used this a lot to just talk about why this was relevant right now, especially during COVID. But, we also had data showing before COVID that mental health was a challenge for the youth in our region. Our partners on the grant, we had the Monroe County Library System, Rochester Regional Library Council, and the Pioneer Library System. And I now know that that is not the right logo for Pioneer, but I didn't have time to change it before this presentation. But Pioneer covers those 4 counties outside of Monroe. We also partnered with the Command G Design Lab, which is a student design lab at RIT. So we had 2 graphic design professors and 3 graphic design students who joined some of our sessions with the youth, and they gave like a 101 on graphic design for the youth. So it was a really great opportunity, you know, not only for them to learn more about mental health, but kind of some, you know, potential career options in the future. So they did that overview with the youth, and then obviously they supported all the design work on creating the resources, and met with youth a number of times to get their feedback on, you know, the design of what we were creating. We also partnered with a young adult librarian from the Brighton Library who helped us write some of the content for the resources. So to create the resources, you know, we did kind of a mental health 101 training with the youth and talked about health literacy. And after we had done that overview, we had some brainstorming sessions with them and asked them these key questions. What do you want your peers to know about mental health? As youth who have experienced mental health challenges, what would make a difference to you? And what might you want adults to know about youth mental health? And so out of that brainstorming session, we got a lot of fantastic information, but we narrowed it down to 4 key themes. So one was that emotions are okay, normal, and valid, regardless of gender and age and orientation. Peers and adults should not invalidate those emotions. We're all whole people. It's really important to listen to each other to understand this. And peers and adults need more education on how to respond to youth who express mental health challenges in a way that's supportive and acknowledges those emotions. So it's kind of one big theme. Another was just that you matter and you're not alone. The third was it's important to speak up for yourself and that you're brave for taking steps to improve your mental health, and every small step matters. And the last was that their generation has unique challenges, and it invalidates their feelings when adults and peers compare their challenges to other generations or situations. And so with those themes, we took those and created these awesome new materials. So we have a 20-page zine, which really kind of like captures everything from that brainstorming session and then some, and I'll show you some more of that in a second. We also have a poster that'll be going in the libraries, and you can't see the text right now, but the text in the bottom just kind of, you know, covers some of those key themes for what the teens wanted their peers to know right now about mental health, as well as some project background and, you know, ways to use the library as a resource when trying to support your own mental health. The bookmarks have similar information, and then the stickers, which were the big hit with the teens, they just have some, you know, some of those themes and positive affirmations on there. And I think those were the favorite of all the teens, so they could stick them on laptops and binders and all of that. So all of these materials have been printed. They are making their way to all of the public libraries across the region as we speak. And let me just show a couple. And again, the text is too small, but I'll give you the information on where you can, you know, look this up yourself. But this is, these are some of the pages from the zine. All these words that you're reading here, a lot of them are direct quotes right out of the teens' mouths. I see all their faces when I look at this, and I really encourage you to take a minute to read it, to really, you know, get an understanding of what teens in our region are feeling and how we as adults can be more supportive of them. These are just some more images from the zine. Closer look at the bookmarks and the poster. And I'm sorry I'm going fast, but I promise we'll send you more information. And the stickers. And I mentioned, so you can find the resources in the library within, I hope, the next week or so. We did send some materials to the teens also, and they will be bringing them back to their school libraries. We didn't have enough to print for all of the schools, unfortunately, but they will be bringing some to their libraries. So I know there were 3 teens from Wayne County, so there will be 3 schools getting some. And then also all of our materials are on our website, healthykids.org/FLX Teens Are All Right. Feel free to download all of these. We have the print files. If you have funding and you want to print your own, we are happy to share whatever we can to get these resources out there. We also have a communications toolkit that's on our website. It has sample newsletter, text, and images that you could use to share about these resources in a newsletter. And we're also doing a social media campaign this month for Mental Health Awareness Month. So in that communications toolkit, there are tons of sample images and captions that you can use to be posting this month to raise awareness about teen mental health. These are some of the social media images, and you'll recognize they're straight from the zine. And then, we take that text that we cut out from the image, and that's the caption. So yeah, I think, and just to get more involved, engage with the local library, encourage teens to engage with their local library, participate in that social media campaign, and really just think about, how at your own organization, how can you create a space that's comfortable for teens to talk about this, because they want to talk about it. They're not afraid to talk about it. They are probably confronting things that are much scarier than you can even imagine, which is what I learned from this project, and they need a safe space to talk about it, and they're not afraid to talk about it. So just think about ways that you can create that space, and then, encourage youth voice in the development of, whatever you look to do to support teens, because they were incredible on this project. If you're interested in seeing more, we do have, they hosted a webinar a couple of weeks ago for their peers to roll out these new materials. And I have a recording, and it will blow you away. So if you want the link to the recording, you can reach out to Jay or myself, and we can share that as well. And I think that's everything. Yeah, my email address is there, hannah.shippey@commongroundhealth.org, but Jay can connect you with me as well. Okay, I hope I stayed under 10 minutes, Jay.
Excellently. That was perfect. We're running right on schedule. So with I think just one more slide after this, I think is the yeah, it's the slide that says Hennessy and Margie take it away. So we are now going to conclude the partnership meeting. The next partnership meeting will be August 5th, which is we're typically second Wednesday. So August 5th is a little off pattern. But that's because the county fair typically can wobble between, I think, second and third week. Maybe it can't wobble. Maybe it's always the second week. Cornell Cooperative folks could tell me if they're on. But anyway, the county fair typically is that second week. So the first week in August, we will be potentially, we're watching to see what happens with guidance and regulations, but we do have space reserved at the BOCES Conference Center for the Diamond Conference Room, or will be virtual. October 13th will be the next partnership meeting. And I want to tell you that August and October will be focused on 2 things: the Evalumetrics Youth Survey, and then really looking at our work groups and saying, hey, are these work groups situated to meet the needs of families and of young people in our community, or do we need to adjust? And we've had the same work group for configuration for about 8 years or so. Margie felt like, did a great job reinvigorating the Wayne Wellness Group and broadening that to recognize and meet some needs there. And I think that when you look at that work, it is indicative that, 2021 and 2022 are certainly not 2012. And we've been doing this partnership for a bit, so we want to continue to evolve. So I really would like to encourage everyone to plan on attending on August 5th if you're able, and attending on October 13th if you're able. We'll be looking at the shape of our work groups. We'll be looking at our planned work together. And, again, that collaboration it happens best when right from the start, people agree to work together on a project. And when we come together and we do cool stuff together, we learn to trust each other. We learn to work through problems. We find the skills that we all have, and it's just overall a healthier collaboration. If you didn't track that, I walked right through the collaboration arch there as I get ready to hand it over to is it Margie Hennessy who's taking the ball here?